Good morning, Dr. Balzhan. Let me introduce you. Dr. Balzhan Aidashova, MD, phlebologist, certified ultrasound specialist. I am Dr. Rishad Gazizov, MD, the founder of Smart Health and Science. We will share our personal profiles in the link to this meeting. I'd like to welcome you, Dr. Balzhan. Good morning.
Good morning.
We will have a very short talk today about the venous pelvic disease in women, chronic pelvic pain, pelvic congestion syndrome, pelvic varicose disease. There are multiple terms that are being used in the literature today. So let's start with the first contact with patient when she walks into your office. You collect patient's history, complaints, examine her. So let's begin with history. What should we look at when talking to the patient about her condition?
Okay. Women with chronic pelvic pain of venous etiology usually complain on dull pain at the lower abdominal area. It can be more prominent at the left side or right side. And what is more important, this pain is worsened during vertical position. It means they cannot tolerate long standing, long sitting, and sometimes even walking. So they try to lay down, but sometimes walking make them a bit better. This is due to improvement of outflow from legs and pelvis. Also, the pain aggravates few days before or at the first days of menses. And the beginning of the onset of this pain, usually after having delivery, pregnancy. The usual patient has 3 children or more than 3 children, but sometimes it can begin at a very young age, which is more maybe have some anatomical features. And one of the specific symptoms is the postcoital pain or deep dyspareunia. And also it is important to ask patients if they have the urgency of urination or the pain on urination, because a lot of patients cannot understand, they don't understand that this pain can be related to varicose disease.
Okay, so indeed, this is not being actualized. They don't realize that. And our goal is to educate healthcare professionals and also let patients know what are the early signs. But first focus are the primary care doctors, like GPs, gynecologists in the outpatient department. So anything else GPs and gynaes should be wary about when talking to the patient? Or do you think this covers all?
The family doctors, GPs, and gynecologists first should rule out another reasons for the pain, means tumors, endometriosis, adenomyosis, and another reasons for the chronic pelvic pain. And then if there is no evident etiology, then they should refer patients to the specific ultrasound and to the vascular surgeon or phlebologist, which is expert in pelvic congestion syndrome.
Very interesting. Thank you. Very interesting. And during the physical exam, anything specific you could observe, or you think that before moving into the instrumental methods of diagnosis like ultrasound and MRI, the most things and the most information can be collected when talking to the patient about the history and complaints rather than physical exam. So what is the value of physical exam of the patient?
Unfortunately, you actually cannot, the symptoms are very unspecific. And on the physical examination, you just can't see anything specific. Or sometimes it's painful palpation of ovaries, which is also very unspecific. So the physical examination, and usually you cannot see varices on their vulva. They usually don't have the prominent varicose veins at their legs. So this is because all the varices are concentrated at the plexuses of the pelvis. They usually, the most painful chronic congestion have no leaking points, which will be, we will talk about the leaking points maybe at our future videos.
Yes, we will further videos, we will focus them on diagnosis, then the treatment methodologies, and also differential diagnosis is important, as you mentioned, between endometriosis and other causes of the pain. This is absolutely new, unexplored area, and your experience and your advice is very, very much valued. I'd like to mention that we will indicate the contacts to this video in the comment section or in the video. Dr. Balzhan, thank you so much for your time, and it was really nice seeing you again. I wish you a very successful good day, and till next meeting. Thank you.
Thank you.
Should you have any questions or comments, please feel free to contact us. Thank you.